I chose to do medicine, I think very early on when I was a child. Actually, when I was about 5 or 6, we were living in the Upper Peninsula, Michigan. We lived in an apartment which is right next to the hospital. And so I remember late at nighttime, he would have to go into the hospital, into the ICU to see a patient. He would take me with him. And that's where I got to see the EKG strips and got really interested in it. And that's where it just kind of developed, where I thought, yeah, this is probably what I want to do. My name is Raul Octaviani. I went to medical school in Ponce School of Medicine in Puerto Rico. My first language is Spanish, but I moved when I was so young that English, became sort of the main language. So now I'm bilingual in both of them, which I think was good to go back and do the medical school and everything back in Puerto Rico, so it's a good balance. Well, I was recently married, Candice, and we have a baby. She's 13 months old. Her name is Cadence. I have 7 dogs. We teach French ring technique to military and police dogs. And putting that together, there's a charity that I work with that's what we do is we'll take a young dog, we'll train them, we'll get them ready, and then we'll donate them to a underserved police department. I think that this small community environment still retains the traditional components of medicine. That's the traditional doctor, the physician, because you have that knowledge. You've been speaking to the patient. You know them. You have that connection, that bond. I think that is being phased out in most medicine. It's become cookie cutter. And so in order to preserve that, I think these small communities still preserve medicine, whereas these large communities, large cities are really moving towards cookie cutter, guideline driven and away from personalized individual medicine.